So the gut is called the second brain because it contains almost the same amount of neurons as we have in our spinal cord. And the second because the gut can work autonomously. So many of the functions, whether it's absorption, secretion, or movement of the gut contents, is executed by the neurons located within the gut. So there is a bidirectional communication between the gut and the brain. So some of the nerves, like the vagus nerves, they have branches within the gut. So the molecules which are being detected by the nerve can transfer the signal to the brain. The other possibility is through immune system. And the third is the production of neuroactive molecules. So we know that gut bacteria can produce typical neurotransmitters, also other molecules which have direct effect on the neural system. We were one of the first ones to show that the changes in gut microbiota composition can affect behavior. And there were several experiments which we performed. The first one, and I think the most striking, was when we treated mice with a mixture of non-absorbable antimicrobials. We changed the composition of gut bacteria, and this was associated with significant change in behavior of mice. And in a way there is a parallel in humans, and it was described on multiple occasions. When patients are treated with antibiotics, sometimes they have sudden change in their mental capacity, so it's called antibiotic-induced psychosis. And again, you stop the treatment with the antibiotics and the patient's behavior normalizes. There is definitely a possibility that just by changing the microbiota composition or just changing metabolic activity of bacteria we have in the gut, we could also affect behavior in humans, in healthy or in patients. Probably within 5-10 years, we will be able to have these kind of treatments available to wide public. So maybe in 10 years, you will be able to go to the supermarket and buy a happy probiotic, a bacterium which will make you feel well. If we are able to understand really the mechanisms by which bacteria affect mental health or behavior of the host, then we can also design specific probiotics, prebiotics or complex foods which would be able actually to have, through the microbiota, some significant effect on our mental health.